helping make your life easier. Moms Every Day.
Hey there, everybody. It's Hattie Cheek with Moms Every Day. We have David Chaffin with us today from Cabell Huntington Hospital. All right, so you've got exciting stuff going on here. A new building, and that's for the Perinatal Center.
Perinatal Center.
All right, so talk about what is the Perinatal Center first?
It's a place where we offer specialized services to take care of pregnant women, high risk and low risk. It's actually a manifestation of Cabell's long-term commitment to providing really what I think world-class care to the population here in the tri-state.
So you see a lot of pregnant women walking in your doors, and what kinds of things should they expect?
Depends on what they're coming for.
Okay.
We offer some very high-tech ultrasound. You may be coming just for a routine ultrasound to look at how far along the baby is. We offer specialized services looking at anatomy. We actually can look at the baby's heart and look for heart defects. We actually have a specialized link with Cincinnati Children's, the pediatric cardiologist there, so we can actually remotely do fetal echocardiograms as well.
Fetal echocardiograms.
Fetal echocardiograms.
Echocardiograms. I didn't even realize that you could detect a heart problem before it was born.
We can detect most heart defects before they're born.
That's incredible.
And then get them into the specialized services that they need at the time of delivery.
So the moment that they're born, you already know that there's another little struggle that you have to overcome.
Correct.
Wow.
Correct. We were the first in the tri-state area to offer 3D ultrasounds and have improved our technique considerably to where we can look at specialized pictures of the spine or the face problems
that's
as
exciting.
well.
I bet you a lot of people are coming out to get those 3D ones now that they're available.
Well, they're available everywhere right now. And these are not recreational ultrasounds.
Right.
These are ones that are targeted looking at potential problems.
Gotcha. And then diabetes, is that a major problem?
That is a major problem. Of course, obesity affects a large number of people in the Mountain State, and that includes reproductive age women. And so we have a specialized diabetes center where we have diabetic nurse educators where women can come and learn the nutritional alterations that need to be taken into account while you're pregnant.
And there are a lot of people, they have diabetes to begin with, but a lot of women, they become diagnosed with diabetes once they're pregnant.
Absolutely. That's called gestational diabetes. And it's actually kind of a battle between mom and baby over who gets to control the sugar.
Exactly.
And unfortunately, in somewhere between 10 and 20% of women, the baby wins. And just like you won't give the child a milkshake every time it asks after it's born, you can't do that before it's born.
Right.
But we take that all the way from dietary manipulations to insulin, medical management, and we actually have the capability to help patients run insulin pumps while they're pregnant.
Now, is gestational diabetes, is that something that you just catch with, or you notice? I know, I meant like you finding it.
Right.
I meant you finding it, not her coming down with it. But the blood, is it just a random blood test that they have to take, or are there symptoms? How do you find out?
In the United States, the standard of care is universal screening. So between 24 and 28 weeks gestation, you drink this syrupy sugar that has 50 grams of glucose in it, and we check the blood an hour later. And if it's elevated, then you proceed to a little bit more difficult test. It's a 3-hour test.
Right.
And then if you fail that, you come and see us.
Okay, and are they immediately, are they clear from diabetes after they give birth immediately, or is it one of those things that it lingers?
That's an excellent question. Some women, it does not go away. Everybody who has glucose intolerance in pregnancy should be tested 6 weeks after. 50% of women who have glucose intolerance in pregnancy will have diabetes within 5 years.
Oh, goodness.
So it's a warning. It's a warning that you may not get any other way.
Right.
So it pays to pay attention.
Good point. It's a warning you wouldn't get any other way. And any other unique services?
Another thing that afflicts women in the Mountain State is high blood pressure, and we have a very unique program where we use a method for looking at how hard the heart's working, how tight the blood vessels are, as well as the blood pressure, and target specifically what's going wrong with blood pressure to reduce problems later on.
Very interesting. Okay, so this is a place where a lot of people come. You're always seeing the problems.
We
though,
are always
right?
seeing the problems,
Yeah.
but we see a lot of happy. We have a wall of pretty pictures of babies before they're born.
Very awesome. There's a lot that goes along with having a baby, so
there
just
is.
something to
There
think
is.
about in case you're
There is.
thinking about getting pregnant. Well, thank you for being with us. Is there
Thank you.
anyone that should reach out to you if they have any questions just over at the hospital?
Just over at the hospital,
All right.
Perinatal Center.
Very good. If you need any more info, you can just head to our website, WSAZ.com. Click on the Moms Everyday tab. You can rewatch the interview, get all the info that you need to know, and then you'll learn more about the Perinatal Center over at Cabell Huntington Hospital. So again, thank you for being here.
Thank you.
Thank you all for joining us. We'll see you right back here, same time, same place tomorrow. Have a good one.